Hello, everybody, and very good morning to all of you. I am Dr. Dvipika Garg, and welcome back to my YouTube channel. I hope you all have seen the previous videos, you have understood everything, and as promised, we are back with test series. Yes, entire test series is waiting for you to attempt it, and today we'll be starting with the very first part of test series. All the questions which we would be doing in the test series have been covered earlier in the previous lectures. So yes, you should be able to attempt it. All you have to do is come along with me and start attempting MCQs. So yes, take up a pen and paper, sit along and start attempting MCQs with me. And what you don't have to forget is to evaluate yourself. Yes, give points and marks to yourself in each and every question. When I am displaying the question, you have to attempt it along with me so that you know where you are standing. Okay, so let us begin with the very first test series. Before we start with the test series, let me tell you some basic points which you all should know and remember very well. That in your NEET MDS examinations, there would be 240 questions in the paper. Okay, for each correct response, you will be awarded 4 marks, and for each incorrect response, 1 mark would be deducted. Yes, so we have negative marking, and you'll be getting -1 for each answer which is incorrect. Okay. However, if you leave a question unattempted, there will be no positive or negative marking, meaning you'll get a 0 mark for that particular question. So yes, these are few things which you have to keep in mind before you start attempting so that you can plan your strategy accordingly. Okay, so most important thing to remember are the latest advancements which are added in your NEET MDS examinations, that is use of image-based questions and patient-based questions. So yes, students, if you are following me on my YouTube channel, if you have subscribed to it, you must be knowing that we have already done 3 parts of image-based questions. In case you have not seen it yet, go back to my channel and start attempting those questions. 3 sessions of image-based questions are already covered. So today we would be doing few MCQs. Starting with the very first MCQ. What is a key ridge? Key ridge is present in relation to upper 6. A key ridge is lower point on the outline of zygoma. It is the highest point on the outline of zygoma, or is it next to external auditory meatus? So key ridge is a very important factor in orthodontics, and the correct answer is it is the lower point on the outline of zygoma. So you can appreciate here in the photograph that this is the key ridge. Okay, it is always present in relation to upper, yes, but then that is a very vague answer. It is present in relation to upper 6, okay, but where is it exactly? It is present at the lower point on the outline of zygoma. This is important whether you are a NEET aspirant or you are an ortho resident. From both the perspective, it is an important question. Moving on to the next question which we have, when the diameter of the wire is doubled, the force exerted on teeth is. Okay, so before you start attempting these kind of questions, one thing which you have to remember is force is equal to d4 upon L cube. Okay, so this is one universal formula which you people should know whether you are a BDS student, NEET aspirant, or an orthodontic resident. So what they are telling is when the diameter of the wire D is doubled, okay, the force exerted on the teeth would be. So when my D4 is doubled, meaning D4 into D4, so my force exerted would be 16 times. Okay, so this is one very important thing which you all should remember, that force is equal to D4 by L cube. The question can also be asked, if the length of the wire is doubled, then the force exerted would be. So you should know that force is directly proportional to diameter, 4 times of diameter, and inversely proportional to length, to be appropriate 3 times of length. Okay, so this is one important formula which you all should know. If you know this formula, you can attempt any of these kind of questions. Okay, so force is equal to D4 by L cube. Next question, intercanine width in maxilla is increased with, okay, eruption of lateral incisors, eruption of permanent canines, eruption of premolars, or eruption of pegged laterals. So when we are attempting a question which seems to be a little confusing, what you have to do is start with the elimination method as discussed and showed earlier. So, intercanine width in maxilla is increased with eruption of pedolateral? Definitely not. Pedolaterals is an anomaly. Eruption of premolars. If it is the intercanine width of maxilla, then it is premolars play no role. So this is also eliminated. And now you are left with just two options, that is lateral incisor and canine. Well, the answer lies in the question itself. It is the intercanine width, so it increases with eruption of permanent canine. Okay, so permanent canine is the correct answer. Keeping the question in mind, we get the answer. Moving on, the next question which we have is transitional phase of dentition is. Okay, so to answer this question, you should be very much thorough with the phases of tooth development, which you have primary dentition, mixed dentition, permanent dentition. Then you know that mixed dentition is further divided into first transitional, intertransitional and second transitional stage. So yes, they are talking about this particular transitional stage. So options. Transitional phase of dentition is during eruption of permanent and exfoliation of deciduous teeth. Yes. After all permanent teeth have erupted. No. Phase during correction of malocclusion. No. That is not transitional phase or none of the above. So no, there we have a doubt. So phase during correction of malocclusion, meaning you are undergoing orthodontic treatment. And after all the permanent teeth have erupted, then there cannot be any transitional phase. So yes, when transition of permanent teeth is occurring after exfoliation of deciduous teeth, that becomes my transitional phase, because there is transition from primary teeth to permanent teeth. Okay. I hope you people are attempting the questions along with me and you're writing down the answers. In case you get any question which is incorrect, in case you get a wrong answer, listen to the explanation which I'm giving to you. In case things are not clear, write down your doubts in the comment section below. Okay, moving on. Ugly duckling stage affects maxillary anterior teeth, mandibular anterior teeth, both maxillary and mandibular teeth, or it causes decrease in vertical height. I'm sure this is a very easy question for you people. So the correct answer is maxillary anterior teeth. Okay, so ugly duckling stage, you all should know, affects people or patients with from 8 to 9 years of age. Okay, and it is characterized by what? And what else is it known as? It is also known as broadband phenomenon, right? So yes, everything about ugly duckling should be clear to you people. And to make it more clear for you, I have an image of ugly duckling. That is, at 7 years of age, what happens? At 9 years of age, what is happening? And 14 years, what is happening? So my ugly duckling stage gets corrected because permanent canine develops. And my ugly duckling stage occurs or happens because of erupting permanent canine. Okay, so ugly duckling is related to eruption of permanent canine. As the developing permanent canine erupt, they displace the root of lateral incisor. See, as this is erupting, it is displacing the root of lateral incisor mesially. This results in transmitting the force onto the roots of central incisor. This is erupting, so it is applying force on the root of lateral incisor. My lateral incisor root moves mesially and it applies the force on the lateral central incisor root. As a result, what happens? Central incisor root also get displaced mesially, leading to the formation of this V-shaped structure in between, or which is also known as transient midline diastema. Okay, so ugly duckling stage is a self-correcting anomaly which gets corrected after eruption of permanent canines. Yes, students, this is a very important topic and you all should be very much thorough with it. Okay, so I highlight it as an important topic. Moving on, the next question which we have is wires, also called shape memory are. Now, again, same thing. If you have seen my previous videos of properties of arch wire, which was put up in 3 parts, properties of arch wire, part 1, part 2, part 3, without blinking an eye, you can just say that shape memory equal to nitinol arch wire. Okay, so my nitinol arch wires, they have two major properties, that is shape memory and super elasticity. Yes, so again, I would request students, those who are only watching my test series, do not do that. Just go back to my videos and watch those videos so that all these things becomes very easy for you people. I don't want your confidence to go down in case you're not able to attempt these questions. Okay, so watch the videos, answer these questions so that you know where you are standing. Okay. Right. Next thing. In nitinol wire, shape remember is in which form? Okay. So again, same thing. Properties of arch wire, we covered austenitic and martensitic forms. How there is change or transition occurs in these two forms. What was hysteresis? Okay. And everything was covered. Yes. So shape memory remains in martensitic form. This is the correct answer, and these are your preformed nitinol arch wires which are available in this particular pattern. They are packed in a package of 10 nitinol wires each, and they are preformed wires. Okay, so when we talk about this, the concept of annealing should also click onto your mind. Okay, and it will only click if you go back to the previous videos and check them out. Next question. The ugly duckling stage is seen at the age of, we just discussed this. Ugly duckling is seen at the age of 8 to 9 years when permanent erupting canines give a push onto the roots of lateral incisor, resulting in transient midline diastema, also known as broadbent phenomenon. Okay? Spacing in anterior teeth in deciduous dentition. Is it common and desirable, uncommon and undesirable, common and undesirable, or is it uncommon? So the correct answer here is spacing in anterior teeth in deciduous dentition is common and it is desirable. And these spaces are known as your physiological spacing. There is 4 mm of physiological space in maxilla and 3 mm of physiological space in mandible. And these physiological spaces are used to accommodate my permanent teeth, permanent incisors, okay, because their mesiodistal width is larger as compared to deciduous teeth, right. The next question which we have is, the term gingival zenith is used to describe gingival height, gingival shape, the most apical point of the gingival tissue, or is it the stippled appearance? See, this is my crown portion, okay, and this from here starts my gingiva. So this point where this has been highlighted, can you appreciate this, how it is highlighted? The most apical point of the gingival tissue, this is your gingival tissue. So the most apical point of the gingival tissue is my gingival zenith. Okay, so yes, this can be linked to periodontics as well, but yes, it is an orthodontic question for you guys. So gingival zenith is not the gingival height or shape, it is the most apical point of the gingival tissue. So yes, students, we'll be covering test series. There are lots of test series waiting for you, and there would be just 10 questions in each test series. What you have to do is just take out 10 minutes of your time from your daily schedule, sit along with me and start attempting these questions. Always take a pen and paper and make the notes of whatever I'm telling you guys. Okay, attempt the questions along with me so that you know where you are standing. In case you got in this particular MCQ, you got a 6 out of 10. Okay, mark the questions which you got incorrect. Come back to the YouTube channel after 15 days, open this particular video and re-attempt it. Okay, that time you should get a 10 on 10. Okay, so that is our motto, to get a 10 on 10 on each and every series which I'll be putting up for you people. That will boost up your confidence. You know, that will prepare you for your exams really well, because all the questions which I will be covering are important. And in case you are getting a 10 on 10, bang on, very good. Keep a track on my YouTube channel. Keep listening to the videos which are being uploaded. Okay, and yes, keep attempting the test series. A lot more is waiting for you people, so you have to stay tuned. This is just the beginning. Okay, so all the very best and thank you so much.